So, what's the best birth control method out there? Well, the answer might lie in what's the best birth control method that's going to work for you. So, let's talk about birth control. Hey everybody, I hope you're all doing well out there. So, today we're going to be talking about birth control. There's a lot of different types of birth control methods that are out there, so I thought I'd change things up a little bit, and I'm gonna do a video series about birth control. So today's video will be an overview of the different methods that are out there, and then I'll make subsequent videos that will go into more in depth of the more popular methods that people use. So, all right, so here we go. So I like to use this graphic when I talk to my patients about birth control. I like it because it splits everything up into what works really, really well, what works okay, and what's not so well. So if you remember my previous video about tips for pregnancy, you remember that 90% of people will get pregnant within a year of trying. So in other words, if you don't use anything for birth control, you got a 90% chance of getting pregnant within a year. So if you're not trying to get pregnant, then you probably want to pick some kind of birth control method. So today we'll go over just the overview about all the different methods that are there. So why don't we just start out with what works really, really well. So these different methods are 99% effective. In other words, less than 1 out of 100 women will get pregnant if they're using these methods. So we'll start from the top. So here's the implant, or the popular one it's called Nexplanon. It's a very popular method that a lot of people are using right now. But essentially what it is that it's a little rod, and it actually just gets injected right under your skin. And so it has progesterone hormone in it, and like I said, very easy to do because just once you put it in there, it's good for 3 years, and you basically don't have to think about anything. So that's the Nexplanon. The next ones are IUDs, and that stands for Intrauterine Device. So these are little T-shaped devices that get placed inside the uterus. So it's something that you do in the doctor's office, and basically we put these little T-shaped devices into your uterus, and there's hormonal ones, like the Skyla and then the Mirena are the popular ones. One is good for 3 years, the other one's good for 5 years. And of course there's a Paragard IUD, which is good for 12 years, and it has no hormones in it. So those are, IUDs are another good effective method, and it's good for people, who are looking for long-term type of birth control methods. And in general, it's usually a lot of people use it, after they're done having children, but, it is still okay to do it even if you've never had children before. So, these are still methods that are available to everyone. And then when you're finally thinking you're not going to have any more children again, you're done, the other way is sterilization, or in other words, tying your tubes. But like I said, that's considered to be permanent. So in other words, you're going to make sure that you're really absolutely sure you're not going to have babies anymore. So that's the ones that I worked really, really well. So working our way down to the things that are okay. So, when we're talking about these methods, they're all really actually good methods. The reason why they're just okay in their effectiveness is because it has to do with actually the user has to do something. So in other words, right, if you take the pill, you have to remember to take a pill every day, right? If you use the NuvaRing, you have to make sure that you put it in and out at the right times. Even when you take the shots, you got to make sure they actually being good and continuing with it every 3 months as you need it. So there's a lot more user error in these methods, as opposed to the ones that we just talked about, where once it's in place, you don't have to do anything. You don't have to think about it. Don't have to take anything. So that's why those things work really well. So like I said, even though these are okay methods, so long as you use them correctly, they're actually very effective. And even how they're saying that even if it's just the okay level, is they're saying 6 to 9 women out of 100 will get pregnant if they're using these. So it's still very, very effective. Okay, so let's talk about the birth control pills. So birth control pills are the most popular method that are out there right now. And they're very easy to use because you just take a pill every day. And then the dosages now are very low, so they're usually very well tolerated, and there's so many different pills out there anyway, so that if you have any problems, you can always usually change to something else, and usually can find something that's going to work for you. So that's the birth control pills. Next is the patch here. So we've kind of gone away from using the patch, mainly because they found that the patch has 60% more estrogen than the birth control pills do. And so we're not sure if that means anything, whether or not it's safe or not, or whether or not there's more side effects or not. So we're really not sure. So everyone's kind of shying away from that. It's still available, but like I said, we just, not really, it's not that popular. Next is the NuvaRing, or the ring. It's a little plastic ring. It's a little rubber ring that you actually can squeeze down so it's flexible. You squeeze it down and you push it into the vagina and you leave it in there for 3 weeks. So after 3 weeks, you just reach inside, you pull it out, you have your period, and then the next week you just start all over with a new one. So it's pretty easy to use as well, because you just put it into the vagina and then you leave it in there. And then I think the biggest thing is getting over the fact that you have to put something in there. But once you actually do it, most people are like, it's not a big deal. So okay, so last on the list there is the Depo-Provera Shot. So it's basically a shot that you get every 3 months. So it's pretty easy to do. It's a progesterone only, so it only has progesterone in it. It's actually very popular when it first came out. And the reason why is because after about maybe 2 or 3 shots, people stopped having periods on it. And so that's why everybody liked it, right? They didn't want to have the periods. But I think the other side effect that it had also was the fact that it made people hungry. So if you weren't really careful, you can gain a lot of weight on it. So, if you're like a person who's, very fit and watching what they're eating and stuff like that, then usually you're going to do fine with it. But if you're a person that's like, oh, I'm hungry, I'm going to go eat, then you can gain a lot of weight on it. So that's why it's still, like I said, it's a good method, but a lot of people, kind of staying away just because of the weight gain thing. So okay, so those were the things that worked okay. And like I said, they're all good methods. The biggest problem is that you have to make sure you use them correctly and use them well, and then it's very effective if that's the case. So let's not going to spend a lot of time on the next row of things that are not so well, because these things really are not really good for birth control. But they're talking about the withdrawal method. In other words, where the male pulls out before ejaculating. So like I said, has a lot of user error in that one. Diaphragm, or the thing about these things, they're kind of tricky to put in there and place it properly, and taking it out. So so that's another not so well working thing. Fertility awareness is just basically that you figure out when the most fertile times of your period is, so the best times to get pregnant are, and then you just make sure you try to have sex where you're not during those times, right? Okay, the last one is condoms. So yes, it's it doesn't work so well because, well, you got to make sure you use it all the time, and a lot of people don't, and a lot of people don't like them. But it does take some time to talk about it, because it's good because it, is needed to help prevent you from getting, sexually transmitted diseases. So, even though it's not that good of a method to use, it can and it should be used with other methods. So in other words, if you have an IUD in there, it's good to use a condom as well, because the IUD will help protect you from getting pregnant, but the condom will help you prevent you from getting any sexually transmitted diseases. So, so like I said, even though, like I said, the condom itself doesn't work so well, like I said, it is something to think about, that you may want to use it concurrently with another method, because it helps to prevent sexually transmitted diseases as well. Okay, so that was just like I said, a quick overview of all the different types of birth control methods that are out there. Like I said, I will make other videos in the future, going in a little bit more depth of what the more popular methods that people use. Okay, so if you need to get started on birth control, give my office a call and come and see me, and we can go in more depth about the different choices that you have out there. Because remember, the best birth control method out there is whatever is going to work best for you. So please be on the lookout for my future videos, which I will go into a little bit more depth, each of the more popular birth control methods that are out there. So anyway, thank you all for listening today. So take care and stay safe. Bye-bye.